Oh, sorry about that. Okay, hey, this is Brad Mayfield. I'm the Director of Business Development with Greater Therapy Centers. You can't see me, but glad to have you here this morning. Thanks for joining us in our series of free webinars. We're hosting these every weekday at 10 a.m. through May 1st, different topics that are relevant, especially to our current situation. Today we have Miguel Valle here with us. Miguel is a physical therapist who works at Greater Therapy Centers in Bedford. And I'm going to give you a little bit of an introduction and then turn it over to Miguel. Miguel received a bachelor's degree in kinesiology with a minor in Spanish at the University of North Texas in Denton. Go Mean Green. He later went on to earn his doctorate of physical therapy at the University of North Texas Health Science Center. Miguel worked full-time in an outpatient orthopedic clinic for over 3 years while also working PRN at an adult inpatient rehabilitation hospital. Miguel has experience working with orthopedic patients of all ages and diagnoses and is certified in dry needling. He has been with Greater Therapy Centers since April of 2019. In his free time, he enjoys spending quality time with his wife, Melanie, who is a pediatric physical therapist, and his beautiful daughter, Nina. Some of his hobbies include grilling, running, hiking, bike riding, and walking his dogs, Chevy and Mia. Miguel also enjoys exercising, including weight training, running, and boxing. Lastly, he likes to explore different areas and activities in the DFW area, including live music venues, salsa dancing, watching movies, and trying out new restaurants. Hopefully, we'll get to start trying out some new restaurants again soon. Miguel's personal goal is to work together with each individual patient to achieve their personal goals through movement. He also wants to continue to learn and gain proficiency with a multitude of techniques that can be used to address the specific needs of each patient. And back to his interests, we will follow up this webinar with a webinar on salsa dancing that Miguel will lead and host and give us some instruction, hopefully. Stay tuned for that. All right, I'm going to turn it over to Miguel, and I'll be back on at the end to give a conclusion. If you have any questions, you can type questions in the question tab below. We really appreciate you joining us, and now here is Miguel.
All right, hey guys, how are y'all? Hope everybody's staying safe, and let's kind of jump right into it. I know you guys are pretty excited about what we're going to talk about today. So what we're going to talk about today is just managing neck pain and headaches, and how it affects us, and what to do with your neck pain and headaches. Okay, so some of your objectives. So again, we're going to understand neck pain and headaches, discuss some of the common causes of neck pain and headaches, briefly explain how neck pain and headaches affects us, and I'm going to give you guys just a brief anatomy of the neck, not the whole thing. That'll take forever if I did that. We're going to discuss a couple of approaches of treating your neck pain and headaches, and demonstrate some effective home exercises to kind of help decrease these symptoms, okay? So let's go ahead and start off with our first slide here. What is neck pain? So I get asked this question quite a bit whenever I have a new patient here that kind of comes and talks to me like, why do we get this? Well, neck pain, it affects usually the cervical region of your spine. It's just here from the top of your shoulders up to your head, or anything that originates from the neck. So for example, if you have radiculopathy, so you go to your doctor and they say, hey, you have cervical radiculopathy. And that usually originates in the neck, and then you get this shooting pain that goes down your arm. That's still considered neck pain, not arm pain, because of where it originates. So we'll kind of discuss a little bit about some exercise to kind of help with that as well. So neck pain can be caused by so many different factors. Poor posture. As you look at the illustration on the right side, you'll see these cartoons, these people looking down at their phone with a forward head, rounded shoulders, very hunched over. They're going to go see the neck pain specialist. This is what we call text neck. You know, now with everybody having smartphones, I kind of look down and stay in that position for a long period of time. It's okay to be in this posture, but just not for a long period of time. It's good to get in and out of postures.
Hey, Miguel, I'm so sorry. Can I interrupt you for 1 second?
Yeah.
I think your mic is hitting your collar and it's giving some feedback through the speakers and kind of, yeah, man, I'm sorry about that, but if
No, you're
yes,
fine.
I
That
think that
better? That should
yes,
do it. I just kind of
I
took it
think it
in
was
for now.
bouncing on that. Yeah, yeah. Thanks, man.
Yeah, not a problem. All right, sorry about that, guys. So let's kind of start back with what I was talking about, the poor ergonomics. So poor ergonomics. Um, so what does that mean? That just means like your workstation. If your laptop or computer isn't at a certain height where you're not having to hunch over like this to look at your computer or look up like this the entire time to look at your computer, you want it to be at a nice level distance with your head. And you also want your arms and your shoulders to be resting at a good position to where you can type on the keyboard comfortably. If you didn't see the with this past Monday's webinar, you should check it out. Devin Johnson was discussing more about posture and ergonomics and how that affects people through their day-to-day lives with work. You guys need to check that one out if y'all haven't. That he'll give you a little bit more in-depth information about the ergonomics part of it. So muscle injury is another factor. Trauma, if you had a fall or a recent car wreck and experienced whiplash, that jarring effect is going to put a lot of strain on those muscles in your neck and joints. Again, radiculopathy, we discussed that. And stress, especially now with what's been going on with the media news and discussing COVID-19, like that just stresses everybody out because we don't know. It's the unknown. And we're learning more and more about it. Stress that you don't have a job right now. All of that affects our neck, our muscle tension, because most of our muscle tension does occur here in the upper traps. So those are some factors that can cause neck pain. So who gets neck pain? The good thing is you're not alone if you have neck pain. Anyone can get neck pain. In fact, 1 in 3 people are affected once a year with neck pain. Usually it's just some common simple symptoms that can be treated easily. You have a very, very low chance of it being something very serious. So those are good notes there for you guys to understand. So what are headaches? So let's discuss headaches. So again, headaches is just pain that affects any region of the head. It can be in the front, it could be to the temples, it could be just behind your head. I highlighted the first 2 of what many different reasons can cause headaches. The first 2 go hand in hand with neck pain. So poor posture, again, having that hunched position, forward head, rounded shoulders, and just a curved back. Being in that constant position can cause headaches. Stress, that's going to affect you as well. Sleep deprivation, you want to make sure you have good amount of sleep. No less than 7 hours and no more than 9 hours. So having too little sleep is going to affect your or increase your chances to get headaches, and anything over 9 hours is also going to increase your chances of getting headaches. Screen time. So binge watching Netflix, which I'm sure a lot of people are doing right now, constantly being in front of that TV, or let's say you're working from home and you're on your laptop the entire time, constant of the LED lights just hitting your eyes like that, right? It's going to affect you because you're just putting so much strain on your eyes for a long period of time that you're just gonna affect the headaches, the muscle that constantly has you just zoned into your screen. You'll notice too, whenever you're watching TV or on your laptop, you rarely move your neck. So when you're involved with so much screen time, you'll start to notice that your neck gets sore and your head starts to pound because of the constant strain that you're putting on your eyes and your neck. Dehydration and skipping meals. You want to make sure you eat. I know a lot of people do a lot of intermittent fasting, which is good, but sometimes if you notice, some of the side effects are going to be having a headache. So just be careful there because your sugar levels will drop. Dehydration. You want to make sure you drink plenty of fluids. Tea doesn't count. I love tea, but you want to make sure you drink plenty of water. I know there's water in tea, but the sugar and the little packages that blend it still going to make you kind of urinate all of the water that's in that drink. So who gets headaches? Again, anyone can get headaches. It's very, very common. Usually nothing serious. 1 in 20 people do experience a headache nearly every day. Some vary from very mild, some to very extreme where you need to go see somebody because it just hurts that bad, or you can't even turn on the lights because it hurts so bad. But again, it's very common and usually it's nothing serious. All right, so let's get into it. So how does neck pain and headaches affect us overall? So of course, we get pain from it. It affects everyone differently. Some people experience pressure. Some people experience radiating pain either down your arm, or if we're talking about headaches, it can wrap around your eye. That's very common. So it's not rare to experience stuff like that. Ache, dullness, some sharp shooting pain, that's all affected as well. And it just varies. Mood changes, like the illustration here on the side, it's going to affect us, just by somebody just wanting to say hi to you sometimes, and you're experiencing this neck pain and headache. You really don't want to talk to them because you're just so upset you can't get rid of this headache. You don't know what to do, and it can affect your mood. So just the point here is just try to relax, kind of calm down. That'll help decrease the constriction of your vessels into that area where you're having all this tension, and it'll help kind of relax you a little bit, loosen it up, and start slowly to decrease some of your symptoms there. Decreasing concentration. You have a headache and you have neck pain and you have to work at home on your desk, it's hard to kind of get the job done sometimes. Because all you're thinking about is your head and neck pain. Less interest in activities, somebody saying, hey, let's go run outside, or let's you want to play with your kid if you have kids at home, and it's hard to sometimes because you just are in constant pain. That's common. Difficulty sleeping or staying asleep. That's going to affect it as well, especially if you're hurting. It's very common to lose some sleep, but the biggest key here is you want to make sure you just try to turn off all the lights, relax, try to do some deep breathing exercises if that does occur, and if it does affect your sleep. That should help kind of relax your entire body, relax your mind a little bit, get your mind off of the pain and headaches as well. Next, so let's talk a little bit about the anatomy. Let's talk about the neck of your bones there. So we're going to talk about how many bones that you have. They're illustrated as C1 to C7. The C part of it just means cervical. That's just what it's called. So the neck contains 7 bones. You have C1 all the way down to C7. The neck contains 26 muscles. There's a ton of muscles. And the crazy thing is, though, when you have neck pain, there's actually a lot of those muscles aren't even affected by it. So here in a couple of slides, we're going to talk about which muscles really do affect us and why they affect us. So the muscles are very important. It provides movement for the neck. So it flexes your head, it extends your head, it bends your head to the sides, rotates it, and that's pretty much it. If your head moves any other direction, you might want to get that checked out. Let's see, it assists with swallowing food. So it helps with swallowing food, helps elevate your rib cage whenever you're breathing, especially when you're going for a long run. You'll notice yourself really having to take those deep breaths, and you can see in my neck here, when I do that, the SCM muscle, so sternocleidomastoid muscle, actually helps lift your rib cage as well. Let's see, stabilizes your head. Unfortunately, not like the guy there on that picture, but and it does so much more. So let's talk about the neck again. So here are the bones. You're going to see the bones there from C1 all the way down to C7. That's how they look like. They're called vertebrae. Those little yellow guys on the sides, those are the nerve roots. So if you experience any of that radiating pain from your neck going down to the shoulder, that's what that is there. It usually occurs right there at that nerve root. Sometimes the nerve compression there can be compressed either somewhere down the chain. So if it's, sometimes it can be compressed in the shoulder, at the elbow, anywhere along that nerve path. But typically it occurs at the neck, okay? Those are the intervertebral discs. So those little jelly-filled donuts. I'm not sure if your doctor discussed that with you guys. If y'all have a herniated disc or a disc bulge, and that's what that looks like. And typically, what happens is that disc will touch or cause irritation to the nerve, and the nerve, what will happen is it'll inflame, and that's why you get those shooting pains down your arm. So the neck muscles, those are a ton of neck muscles. We're not going to talk about any of those, but those are just the 26 muscles. If you want to take a look at it, you can just kind of zoom in and take a look at what they are. And yeah, that's a lot of complex structure there. Let's take a look at the most important muscles that we want to talk about. So let's start with this diagram on the left here. It shows the trapezius muscle. So this is a very important muscle for anyone who's experiencing neck pain and headaches, actually. The upper trap muscle is the most involved muscle with neck pain. Okay, so the upper trap muscle, you can see it starts from the neck and it goes all the way down to the spine. You just want to focus on just the top half of that muscle. That's what we call the upper trap muscle. So this guy right here. It usually is where you hold a lot of stress or you feel these big knots. I'm sure if you guys touch on your shoulder, the top part, you're going to feel a very tender spot. That just means that that muscle's really tight right now. And we need to stretch it out. And I'll show you a couple of those exercises too to help loosen that structure out. Next, you'll see is the levator scapula on the right side. That just starts right here on the top of the shoulder blade, and it connects to the bones, the side of the bones there in the neck. That's another common structure that will get tight, that can even compress on some of the nerves. So sometimes when you get that radiculopathy symptom, it doesn't always occur due to a disc. It could be because a structure is just really tight. So stretching out some of the muscles will help relieve those symptoms. And then the rhomboids there at the bottom, they're not technically cervical muscles. They're within the cervical region, but they're so important because those are our postural muscles. So that is actually in the thoracic region, so your mid back. And those are very important because those are the muscles that you want to make sure you strengthen well to keep you in this good upright posture. Okay. And then on the right here, the deep neck flexors, those are very important because that's what helps kind of stabilize our neck. So I'm not going to talk about each and every one of them, but just I like to group them as deep neck flexors. So I'll show you an exercise to help kind of strengthen that area and help bring your neck back into a good posture. Okay. So again, when we put it all together, one of the structures that didn't show you was the pecs. Everybody knows what the pecs are. It's the chest here, the chest muscles here. So usually what occurs is whenever you have a really tight upper trap muscle or a levator scapula muscle or both, with posture, this is how it gets affected. Your pecs get tight. You have weak, deep neck flexors and weak postural muscles. So those rhomboids and the lower traps there are going to get affected. So when you constantly stay in this position here where your shoulders are rounded, you're looking at your laptop or just playing video games or whatever you might be doing, when you're in this constant position here, this is what happens to your body. The upper traps get tight, the muscles get weak here, the pecs get tight. So we want to correct that. That's why it's very good to have and maintain a good upright posture. Okay, so what do you do when you experience these symptoms? First and foremost, you want to take a break. You're only supposed to spend three hours with screen time. Anything greater than that is going to affect you with your headaches and your neck pain. I don't know what happened there. Sorry about that, guys. Let's take a look. There you go. So make sure you take a break. I know with work it's hard. You guys are probably saying, well, I have an 8-hour shift today and this is my only break. So it's okay. Just try to take 30-minute breaks if you possibly can. Any time to get up out of your chair, move around, walk around is more beneficial than you just staying in that chair the entire time. So take a break, get out of that posture, take a break from the screen time a little bit, let your eyes focus on something else. That'll help decrease your headaches. A good tip that a headache specialist kind of discussed with me is when you start to experience these headaches, look outside your window and try to focus on something far into the horizon. That'll help really adjust your eyes, because if you're constantly staring at that screen, you're going to strain them so much that it's only used to, this distance of where your eyes and your screen are at. So try to get up, go to the blinds, open it, try to look at the horizons. Sometimes that little quick fix can help control your headache, or in this case, get you up out of your chair and move your neck around to help control your neck pain. De-stress, do some yoga techniques, some breathing, go to the other room, close the blinds, shut the lights off, and just kind of relax. Try to let your eyes from it to strain as much, or do some yoga techniques to kind of help with your neck. That'll help kind of calm things down, get your mind right, and it'll help control some of your symptoms as well. Body mechanics, again, posture and ergonomics. Again, please go to Devin Johnson's webinar that he presented this Monday. It's all going to be there on the Facebook page of Greater Therapy Centers. There should be a link kind of sending you guys to YouTube to kind of check those out. So he's going to have a lot more in-depth detail about ergonomics there, okay? Heating pad, you want to place a heating pad with enough layers. You don't want to just put a straight heating pad on your neck. You want to make sure you have at least 2 or 3 layers in between, just so it doesn't burn your neck. And usually just 10 minutes, anything greater than 10 minutes around your neck there will just cause a systemic effect, which what that means is it'll make you start sweating profusely and stuff like that. And you don't want that, because then you lose the benefit after that. So just 10 minutes is good enough. That'll help control your muscle tension, and it'll also make your neck feel good. Help calm those nerves there as well. Try applying a cold pack to your forehead when you have a headache. The reason behind that is a lot of people try to go straight to medication. Yeah, medication can help, but sometimes it's temporarily, and sometimes some people can get a rebound effect. So they're in constant need of needing to take Tylenol or ibuprofen to help control the headaches. Try to avoid that if you can, because you're gonna need that every single time you experience these issues. So try a cold pack instead. See if it calms down. If it does, great. Usually it does. You don't want to experience that withdrawal effect or that rebound effect to where your headaches or your neck pain gets worse. And of course, exercise, doing gentle exercises, doing gentle stretches, and just moving your neck, doing active movement is really good. Gets the blood flow flowing, helps loosen up your muscles naturally. So let's go ahead and jump into that. So some of the exercises for neck pain and headaches. So active movement, literally just take a break and just start moving your head up and down. Hold it for 3 seconds. If some of you might be doing this right now and you probably experience a pop here and there. Those pops don't mean anything. That just means pressure is being relieved because you haven't moved your neck in such a long time. So move your neck around. You know, that'll help kind of control some of the situation, at least temporarily. So the upper trap stretch, let's go ahead and let me demonstrate that for you guys. So as you see the lady there, she's kind of holding the top of her head and pulling. Let's try not to do that first. Try to tilt your head first and just let it relax for a second. Usually I have people do this here at the clinic, 30 seconds. Generally it's 30 seconds. Again, some people have to change it up and be a little specific with them, but usually it's 30 seconds and you want to hold it. Do it 3 times. You want to get in and out of that position, just like that. Very simple. If you're not feeling a stretch, that's when you want to put your hand on your head and gently pull your head down. Okay, don't force it. You know, you don't want it to rebound because then the muscle tighten up again. So just gently press down, and that'll help stretch out the upper trap muscle that we were talking about. Again, that's the most common muscle that is affected or that's involved with neck pain. So that'll help kind of control that muscle tension there. The levator scapula stretch, or the cowboy stretch, you might have heard it as the cowboy stretch or the armpit stretch. Typically, what you want to do, you want to go down, you want to turn your head, look down into your armpit here, and just gently look down like that and try to relax your body. You should feel a stretch here. On the opposite side, if you're not feeling the stretch, you can perform it like the gentleman there. You just grab the top of your head and again, gently, just make sure you gently pull down, okay? So you turn your head and gently pull down, hold it for about 30 seconds, do it 3 times, and you can do it on both sides. If you're still not getting a deep stretch, what you want to do is you want to put your opposite hand behind your back and then perform that exercise again. So that'll make it an even deeper stretch. All right, so this next exercise here, for a lot of people who have a lot of postural issues, it's just hard for you guys to just kind of get up into this good upright posture. Start off with the doorway stretch. That's what that lady right here with the Under Armour shirt is performing. Just put your hands either up here, it can be level, or it could be down here if it's your first time doing it, onto the door frame, and just take a small step through the door while your arms are still on the frame, and hold it again, usually for 30 seconds. Do it 3 times, and you'll start to feel a big, deep stretch right across your chest. So with those tight pec muscles, it's going to bring your shoulders. It's going to round your shoulders, and the key to this is obviously to help loosen up the pec muscles there, to kind of help improve the flexibility there, so you can pull your shoulders back. So doing that exercise there will benefit you if you have any postural issues. All right, so next, doing shoulder blade pinches, you could do them seated in your chair, you could do them standing up, whatever it may be. You just want to make sure those shoulder blades are going back. So just like the gentleman there, when you can see it with the arrows, he has a nice crease in his mid back there. So that's what you want to do. You want to pretend like you're trying to squeeze something with your shoulder blades. Hold it for about 5 seconds and then relax. Typically do this 3 sets of 10. So a total of 30 times. Pinch, hold back for about 3 to 5 seconds. and then relax. That's just another way of kind of just getting you in and out of that posture, and at the same time activating those postural muscles, the rhomboids that we were discussing earlier. Let's look at chin tucks. So remember those deep neck flexors that I was talking to you guys about? So this is the exercise that you want to do to gently activate those deep neck flexor muscles and also help relax some of the extensor muscles here in the back of your head. It'll help align, or I should say move your neck better. So you want to bring it back like this. I know you guys are taking a look at my double chin right now. So you just want to tuck your chin in and push your head back. So like that. Hold it for about 5 seconds. Again, do that about three sets of 10, so 30 times. Hold it for 3 to 5 seconds. And it's that simple. So for my ergonomic people, or people who just work on the laptop or computer for a long period of time, that picture is just a quick picture of how your head and your body needs to be aligned. Whenever you're sitting at your desk, make sure you check your chair height, make sure you check where your elbows are at. So your head, neck, and elbows should all be in that same plane. So there should be an invisible line where you're upright like this. Check your chair height, make sure it's not too low, make sure it's not too high. If it's too high, it's going to affect your legs, it's going to affect your low back because of the way the pelvis moves, and stuff like that. And just keep your distance with the screen. You don't want to get too close, or then you're going to really increase your headaches quicker that way. So take a couple of inches off and extend it to about 24 inches. That'll help with any of your cervical headaches there. Okay. So lastly, if you guys have some more questions about any of your headaches or any ongoing issues, even with these exercises that I demonstrated, please give me a call. Go to Greater Therapy Centers, our website there, look me up, or look up any of the other locations, and feel free to contact us. We're here for you guys. So we want to make sure that you have a better quality of life, and that's our overall goal. I know headaches and pain can literally be a thing, but we're here to help you in any way possible. So do not hesitate to contact us. This will be a great way for you guys to get a very detailed and more specific exercises for you guys if you need that. Okay. Again, it was very nice getting to present this to you guys. If you have any questions, just give me a shout.
All right, Miguel, thanks a lot. And thanks everybody for joining us. This is Brad again. Appreciate you taking your time to be on with us. This is great information. Like Miguel said, you can hit our website, greatertherapycenters.com. We are providing telehealth services at all of our locations. So if you do need a little bit more in-depth assessment and treatment plan, we can certainly help you out with that. Just contact us and we'll get you set up. We will be posting these webinars, this and all the webinars that we host, to our YouTube channel. It's Greater Therapy Centers. There you can search. We'll also be posting updates on our Facebook page every day and Instagram account. So thank you so much for taking your time. We hope everybody's staying safe, and we will talk to you again soon. Thank you.